Coronary angiography is the gold standard for visualizing coronary anatomy in the clinical setting. To visualize coronary vessels with angiography, a catheter is often inserted into the patient's femoral artery in the groin. The catheter is then advanced through the arterial system until it reaches the coronary ostia, which are the openings of the coronary vessels. Once the catheter is positioned, a contrast dye is deposited into a coronary artery. An X-ray source and image intensifier are then used to visualize the heart's arteries. To interpret coronary angiograms, one must understand the angiographer's perspective. Coronary arteries are best visualized from either the left or right oblique angle. This angle refers to the directionality of the X-ray beam as it enters the body. For example, a right anterior oblique view is best for visualizing the left coronary artery. This means the X-ray beam enters through the right thorax at about a 30-degree angle to detect contrast in the left coronary artery. A left anterior oblique view is best for visualizing the right coronary artery. In addition to two oblique views, the X-ray beam is also strategically positioned along the long axis of the patient. When the X-ray source is angled so that the beam is projecting toward the head, it is called cranial angulation. When cranial angulation is used, a diaphragmatic shadow is visualized on the angiogram because the beam must pass through the diaphragm before it reaches the heart. When the X-ray source is angled so that the beam is projecting toward the tail, it is called caudal angulation. No diaphragmatic shadow is visualized when a caudal projection is used. To help you better understand the concepts of coronary angiography, I have painted coronary vessels on a milk bottle. This prop serves as a glass heart so that you can see how the X-ray beams pass through the heart to detect the coronary anatomy. On this glass heart, here is the right coronary artery and its branches. Along the right heart margin is the right marginal artery. And here along the posterior aspect of the heart is the posterior interventricular artery, also known as the posterior descending artery. Here is the left coronary artery and its two branches. This branch anteriorly positioned is the left interventricular artery, also known as the LAD, which stands for the left anterior descending artery. This is the widowmaker. Along the lateral periphery of the heart is the circumflex artery. For the purposes of this demonstration, my X-ray source is a flashlight. When the X-ray beam is projected at a left anterior oblique angle, the right coronary artery and its branches are visualized. Here is the right coronary artery. Notice how the right coronary artery has a characteristic hook shape to it. Arising from the curved portion of the hook is the right marginal artery as shown here. This artery supplies the lateral wall of the right ventricle. The posterior interventricular artery, also known as the posterior descending artery, arises from the terminal end of the right coronary artery and is shown here in the lower aspect of the image. Recall that the posterior interventricular artery supplies the atrioventricular node and the posterior one-third of the interventricular septum. Now the X-ray beam is projecting through the heart at a right anterior oblique angle with cranial angulation. From this view, we now see both the LAD, shown here, and the left circumflex artery, shown here. Notice how the LAD is at the top of the image. This is because the left anterior descending artery runs along the anterior aspect of the heart, as shown here. The left circumflex artery is wrapping around the side of the heart, and so it's seen lower in the image because it's supplying the lateral wall of the left ventricle. In real angiograms, you'll see the LAD running toward the apex of the heart, and you may be able to see tiny septal perforator branches extending from it. The septal perforators supply the anterior two-thirds of the interventricular septum. Hopefully this demonstration gives you a better appreciation for how to visualize and interpret coronary angiograms. Now it's time to practice and apply these concepts to real angiograms. Good luck as you get to the heart of your studies.